Common injuries, sporting field and exercise related areas are basically related to the knee, the ankle, and most commonly in the shoulder and sometimes in the elbow. The commonest injury that we especially see in budding footballers or athletes is around the knee and the ankle, which is the most commonly seen in our practice, followed by shoulder and elbow injuries. The commonest injury around the knee that today we see as related to sports is the ligament injury, that's the ACL, the anterior cruciate ligament injury, and also the MCL, that is the ligament on the side. These are the two commonest injuries that are seen. And the other injuries we see is in the ankle, where the ligament, the ATFL, that is the anterior talofibular ligament, gets injured. Commonly, most people come to us saying that they are ankle sprains. In the knee, they come to us saying that they have instability in the knee. In the shoulder, most of the time, it's either pain or restricted movements. So these need to be investigated and then decided what to be done upon. Most commonly, these happen when these young athletes and people who exercise do not warm up well, and they need to warm up very well, have their joints supple before they go in, and they need to also strengthen themselves. That's the reason if they don't have enough strength and do not warm up well before a game or before exercising or starting, then the injuries are very common that we see. I think the moment a person gets an injury, we see a lot of them now coming with footballers, with wrestlers, with kabaddi players, athletes, jumpers. We see a lot of these. I think the first thing that comes to your mind once you injure yourself is what is called as RICE. That means you should immediately rest it, put ice on it. We should put a compression bandage like a crepe bandage and elevate the limb. That is the thing that should be done first. And immediately after that, a doctor should be consulted, an orthopedic surgeon who should be consulted for it. I think primarily everyone should know what is RICE: rest, ice, compression and elevation. It's mandatory once you get an injury, and I think that takes you a long way in trying to heal yourself. I think the first step to recovery is not self-medicating. I think you should try and go and consult a doctor, especially for the kind of injury. The commonest thing is seeing an orthopedic surgeon. Nowadays, most orthopedic surgeons have their subspecialties, like they may be more interested or more inclined towards the knee, the hip, the ankle, the shoulder. I think you should find someone who's doing that. A lot of speciality has come into our country also. And I think the first aim to recovery is go and see your doctor and try and follow his advice. I think none of the injuries should be ignored. Swelling is a sign of an injury happening inside. You should go and consult your doctor, get yourself properly investigated, and then whatever advice he gives, I think you need to follow that. A lot of times you don't need surgical interventions, but you may also need surgical intervention. Both these decide. There are different types of treatment protocols following that. But I think it's paramount that you should follow your doctor's advice very strictly. If he advises you rest, or if he tells you to mobilize it, or kind of exercises he gives you, I think that's paramount that you try and follow your doctor, whoever you've gone to. I think it's very, very important. I think it's very important to follow what your doctor says, and if he has advised you physiotherapy, I think it should be done very diligently, because it can lead to a restricted range of movement and painful joint, whichever joint has got injured. But it has to be done in consultation with your doctor and in tandem with your physiotherapist. It can accomplish strength and a good range of motion. You gain a lot of strength in your muscles around, stability, and also you get a good range of motion, because surgery or immobilization has one role, but beyond that you have to get back function. I think the physiotherapists help a lot retaining your function.